Hey everyone, welcome. Today we're diving into something totally fascinating. We are going to decode 20 of the most common chronic health conditions. But more importantly, we aren't just going to look at them in a vacuum. We're going to explore how they intricately weave together inside our bodies to form this massive, interconnected web of chronic health.
So let me ask you something right off the bat. What on earth does the silent killer, a butterfly gland, and your annoying spring hay fever actually have in common? It sounds like the setup to a strange riddle, right? But the answer lies right there in the complex, hidden systems of your own body. Stick with me, because the surprising connections we are about to uncover in this explainer are going to completely change how you view your health.
To figure that out, we're going to follow a quick roadmap. First, the silent health epidemic. Then, the metabolic domino effect. After that, inflammation and immunity, followed by the mind-body connection, and finally, taking back control. All right, let's just get right into it. Section 1. The silent health epidemic. You know, what's really wild, and honestly a little scary, is that some of the absolute biggest threats in modern medicine actually develop completely under the radar. I'm talking decades before you ever feel a single symptom.
Take hypertension, for example. You probably just know it as high blood pressure. Basically, it's when the force of the blood pushing against your artery walls is consistently way too high. We literally call it the silent killer, and for a really good reason. It usually sneaks up on you over many years with absolutely zero noticeable symptoms, but the whole time, it's quietly damaging your heart, your brain, your kidneys, even your eyes. It is exactly why something as simple as getting your blood pressure checked with a cuff is an absolute game changer for early screening.
And then there's this number, 40%. That is the staggering percentage of adults in the US affected by obesity. For the longest time, society just wrote this off as a simple lack of willpower, right? But modern research tells a totally different story. Actually, scratch that, it completely flips the script. Obesity is a highly complex chronic disease driven by your genetics, your hormones, your metabolism, and your environment. When you take in more calories than you burn, that excess body fat puts immense strain on pretty much every single organ system you have. Looking at it as a medical condition rather than a personal failing totally changes the narrative, and it helps us understand how it triggers so many other issues. Which leads us nicely right into Section 2, the metabolic domino effect. Basically, when one of these metabolic conditions pops up, like obesity or high blood pressure, it almost always acts like the very first domino in this dangerous body-wide chain reaction. Let's look at coronary artery disease to see how this works. It kicks off without any warning. Fatty deposits called plaques just start silently building up inside your coronary arteries. As the years go by, those arteries naturally get narrower, which literally chokes off the oxygen-rich blood your heart desperately needs. And then, out of nowhere, a plaque can rupture, form a blood clot, block the flow completely, and boom, a heart attack. Notice the theme here? The setup for this takes decades, completely in the shadows. Now here is an insider medical term you should definitely know. MALSD. That stands for Metabolic Dysfunction Associated Steatotic Liver Disease. It's a mouthful for sure, but it recently replaced the older term fatty liver disease. Basically, it happens when excess fat builds up inside the liver cells of people who consume little to no alcohol. It is heavily tied to obesity, insulin resistance, and metabolic syndrome. Because your liver handles hundreds of vital metabolic functions, when fat builds up, the whole organ gets inflamed, and that silently leads to scarring or fibrosis. And you know what? All these big, daunting conditions tie back to the exact same metabolic strain. High cholesterol, that's just excess LDL, the bad cholesterol, forming plaques in your vessels. Type 2 diabetes, that's your cells resisting the hormone insulin, so glucose just builds up and damages blood vessels everywhere. Even obstructive sleep apnea. That excess weight actually causes your throat muscles to relax and physically block your airway while you're sleeping. And eventually, diseases like diabetes and high blood pressure team up to severely damage your kidneys, causing chronic kidney disease where they just lose their ability to filter out waste. They are literally all interconnected dominoes. Okay, moving on to Section 3, inflammation and immunity. We've talked about metabolic strain, but what on earth happens when your body's own natural defense system basically goes rogue, or when inflammation just runs unchecked? Well, just think about your lungs. Normally, air flows totally free, right? But contrast that with the devastating effects of inflammatory diseases like COPD and asthma. With asthma, which is usually triggered by allergens or working out, the lining of your airway gets super inflamed, the muscles tighten up, and all this excess mucus just severely narrows the passage. COPD, on the other hand, which usually comes from years of cigarette smoking, actually destroys the tiny air sacs and causes chronic bronchitis. Inflammation takes the simple automatic act of breathing and turns it into an exhausting chore.
But this inflammation doesn't just stay in your lungs, it extends everywhere. Take psoriasis, which creates these thick, scaly skin plaques because your cells are just growing way too fast. Or eczema, which severely weakens your skin barrier. Or even hay fever, where your body violently attacks totally harmless tree or grass pollen. These seem like totally unrelated issues, right? But they are all driven by the exact same immune dysfunction. In fact, if you have eczema, you're way more likely to also have asthma and allergies. Doctors even have a linked chain name for this, the atopic triad.
We even see this kind of inflammation and physical deterioration in our joints. A healthy joint has this nice, smooth, cushioned cartilage that keeps things from creating friction. But with osteoarthritis, that protective cartilage just gradually wears away until, ouch, your bones are quite literally rubbing painfully against each other. And a really important takeaway here. This is not just some simple, unavoidable consequence of getting older. It's a complex degenerative disease, and it's often made a whole lot worse by previous injuries or obesity. Let's pivot to Section 4, the mind-body connection. There is an absolute, undeniable physical link between our neurological health, our psychological health, and our overall systemic health. It is not just all in your head. It is literally in your biology. There's a fantastic quote from the source material for this explainer that I just have to share. It says, "Modern neuroscience has shown that depression is a genuine medical condition involving measurable changes in brain function rather than a sign of weakness." I mean, how profound is that? Depression involves highly complex interactions between your brain chemistry, your genetics, and your physical health. The same goes for anxiety disorders. They happen because your physical stress response gets totally stuck in overdrive even when there's no immediate danger. Both of these are highly treatable, very real physical shifts in your brain chemistry. Your brain and body are basically talking to each other 24/7. Take migraines, for instance. They aren't just bad headaches, they are massive neurological events involving nerve cells, blood vessels, and serotonin, often causing visual auras and extreme sensitivity. Oh, and hey, remember that hook from the very beginning? Hypothyroidism is what happens when that tiny butterfly-shaped thyroid gland in your neck slacks off and doesn't produce enough hormones. When that little butterfly underperforms, your entire body's energy production, your metabolism, and even your heart rate literally slow down. It can even cause persistent fatigue and clinical depression. Stress and lifestyle also deeply mess with our digestion, which brings us to GERD, or gastroesophageal reflux disease. Think of your lower esophagus like a mechanical valve. Normally, it opens to let food drop into your stomach, and then it seals tightly shut. But with GERD, that valve gets weak or just relaxes inappropriately, and all that highly acidic stomach content splashes backward. That persistent heartburn isn't just uncomfortable. Over many years, that acid can severely damage the delicate lining of your esophagus. Okay, I know we've covered a lot of heavy information today, but we are pivoting now to our final section, taking back control. Because here is the single most empowering reality about modern medicine. Our daily lifestyle choices allow us to manage, or in many cases, completely prevent these diseases. Osteoporosis is the perfect example of how you can take back control. With this disease, your body starts losing bone mass way faster than it can rebuild it, making your bones super fragile, and it happens completely in the background. But you can get a simple DEXA scan to check your bone density early on, long before you ever experience a devastating fracture. And once you have that knowledge, you can jump in with weight-bearing exercises, calcium, and vitamin D. You can literally stop a stealthy disease right in its tracks just by looking for it. And honestly, here's the absolute best part of this massive, interconnected web we've been exploring today. Because these conditions are linked, the solutions are linked too. It's like the ultimate preventative cheat code. Regular physical activity, eating healthy, managing your weight, quitting smoking, keeping your stress in check, and getting good uninterrupted sleep. Those exact same lifestyle interventions treat and prevent almost all 20 of the complex chronic conditions we just covered. By treating one, you're actively preventing the others. Which really leaves us with one big final thought. Today, we've learned how hypertension, high cholesterol, early kidney disease, and osteoporosis all share one truly terrifying trait.
They do their damage without warning until it's already done. So, knowing that the absolute biggest threats to your long-term health operate completely in the shadows, I have to ask, when was the very last time you actually scheduled a routine checkup? Seriously, don't wait for a symptom to tell you something is wrong. Take the knowledge from this explainer, take back control, and book that screening. Thanks so much for joining me.